Hello, Rich, Amy, and Bobby. How are you?
Good, how are you?
Hanging in.
Great, thanks.
Why is my sound not going through here? Can you guys hear me?
Yep, just fine.
I hear you coming. Can you hear me now?
Yeah. Can you not hear me?
I can, but I'm not hearing you through my headphones, and usually the sound is really bad for you guys if I'm not on my headset. So
Oh,
do you wanna
You sound fine.
leave the red on? It's not that. It's coming. All right, I'll just leave
hey
it.
there, Joe. Good to see you.
Hello all.
Then it's not that. It's coming through. It's not coming through. What does that mean? No, it's not. The sound is not coming through the headphones. It's coming through the computer. No, I didn't hear it. I know. Yeah. I don't know how to fix it. I mean, unless the Bluetooth isn't connected. I know it was fine like 5 seconds ago all day. But see what I can do.
Amy, you had a very good meeting the other day, I gather from an email that was sent out. Is that true? Are you muted or?
Yeah, Amy, you're muted.
Sorry. I said I have very good meetings almost every day, Joe.
Sorry, I can't come to meetings during the day because I'm helping teach at the Biotech Academy.
Oh, nice.
And that has just started again.
Nice.
But if maybe we can set up a meeting in the future and you can give me a brief update as to what's happening.
Hello.
Hey, Claudia.
Oh, hey, Claudia. Hello, Fred.
Greetings.
Fred?
I'll pop in.
It was hard to get on. I think I think it's the weather or something. Took forever for my internet.
No, it's just Lanesville.
Yeah, well, that's it. The weather.
You must be running low on kerosene.
Something.
Well, Rich.
Hello, Fred.
Hey.
So I found out that the performance I'm going to starts at 8, not 7:30. So I have a little bit more wiggle room. 'Cause
Hopefully it's indoors.
feels like it's an important meeting. There's a lot on the agenda.
There's Rob.
Hello. Rob.
Hi, Rob.
Hey, Rob.
We're on.
Tried to print all the info and I tried printed some invoices that I had. There was like 60 of them. So I'm waiting for those to finish up before everything else prints out.
60 invoices. Sounds like you're doing well.
Well, no, it was the other way around. It was the supply house invoices.
Oh, money going the wrong direction. Is that
Exactly.
it? Still, 60 invoices implies that you're busy.
I am. I'm very busy.
That's good.
Everyone seems to be busy in this construction and
And every end, we're really,
Yeah.
we're over the top too.
Robbie, is your supply of materials delayed like they are in the construction now?
a lot of them are, yeah, but not critically like building materials. In the plumbing world, you can kind of go around. You don't have to use the same exact one. You can maneuver and get around it. So far we've been lucky.
Good. Yeah, I understand, like a custom window can take 3 months.
3 months, yeah, anything special order like fixtures, and I'm hearing nightmares.
Yeah.
I mean, I was talking to,
You never get done in one place to move on to another. And anyway, it's tough.
We get started.
Sure.
It's 5:30. Okay. This is the Board of Health meeting for August 5th. It's 5:30 PM. It's a remote meeting. The meeting is being recorded. And as I said, this meeting is recorded by video and audio in accordance with the state open meeting law pursuant to section 20, chapter 20 of the Acts of 2021. This meeting will be conducted by remote participation. The public may not physically attend this meeting, but every effort will be made to allow the public to view and listen to the meeting in real time and participate when necessary. Additionally, all votes taken by the Board of Health during this and future remote meetings will be by roll call vote. If you are calling in on a phone, you can press *9 to request to speak. If you are watching on a computer or device, there is a raised hand button and you can tap or press to speak. Please use either of these options during all communication to be recognized to speak. The listing of matters is those reasonably anticipated by the chair, which may be discussed at the meeting. Not all the items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law, and the order of the agenda may be modified at the board's discretion. So everybody, welcome. Let me go to the top of the agenda here.
Doing a roll call.
roll call.
We'll do a roll call. Rich Sagal, Chair. Amy,
Rick Cohen, member.
Claudia Schweitzer, member.
Rob Harris, member.
Joe Rosa, member.
Max Shank, interim director. Oh, not yet. Assistant director.
Bobby Orlando, recording secretary.
Amy, you're on the panel. You should just identify yourself.
Hi, I'm Amy. I'm the Regional Prevention Director.
We will start with public oral communication. This is an opportunity for anyone not on the board to speak on any topic up to 3 minutes on an item not listed on the agenda. If anyone wishes so to speak, please raise your hand or hit *9.
Patty Page would like to speak.
Okay, this will be,
Oops.
all speakers will be limited to 3 minutes and Max will do the timing.
All righty. I think you're all set. Go ahead, Patty.
Hi, Patty Page, 3 Tidal Cove Way. I'd like to bring up and provide an update to the state mosquito control policy. I appreciate everyone's support in the state's mosquito opt-out process. As we know, mosquito season is here, and we have to be proactive in our program and response, or we jeopardize our chances of exemption from the state control program in 2022. It seems like the state may have upped the ante a little bit from when we filed the opt-out application and approval. The state expects cities and towns to be taking action during this mosquito season in order to qualify for that 2022 opt-out. The city must meet expanded requirements, and there'll be more stringent reviews from the state in their applications for next season. It seems that the state's requiring a bare minimum they're signaling to the municipalities. And the 4 items are source reduction programs, data collection and analysis, efficacy assessment, and public education and outreach. Now, I understand the opt-out application and what was approved. Mostly, we were all encouraged that public education be the minimum. That doesn't seem to be what the state is now signaling to us. So I'd like to find out how the city is really addressing this. Is there any communication and coordination between the Board of Health, Health Department, the city, and the state on this issue? Who is the point person in the city? Should there be a subcommittee set up to address this? If this program, you know, if these programs aren't initiated, do we risk our approval for opt-out next year. I would respectfully request that someone provide me feedback, some communication here from the Board of Health, the Health Department, or any appropriate official. I find it, rather limiting and difficult. I do appreciate the opportunity to speak at these oral communications, but I'm going to really respectfully request that this doesn't end up in just a thank you and it disappears and goes away. I don't know how to invoke that communication. I don't know how to invoke that relationship, but I'd be very willing to try to find out. And if someone would connect with me, I'd appreciate that with some kind of response. Thank you very much.
Pardon me, just one second. So I'd like to respond real quick. I have been in communication with Ms. Page in regards to whether or not the city is meeting its mandates as per the plan. And she's been provided some information through Freedom of Information requests. However, what I would ask in return from Ms. Page is to email me, and she definitely has my email address, to email me what she's referencing from the state in regards to new requirements, because I've not been made aware through any kind of communication that the state has upped the ante in terms of its reporting requirements, at least for this year. And if they are upping the requirements for potentially next year, again, that hasn't been communicated to the department whatsoever. And so if she has any information that I need to be aware of, I'd be happy to see it and have a discussion.
Okay, Max, and thank you. I will do that. I'm getting this information from the Gloucester approval letter itself from EEA, and another communication which you wouldn't have access to, but I will provide, has been some senator communication that they've sent out.
Let me
And
just interrupt. This is really not meant to be a back and forth area of
I'm
discussion.
afraid the 3 minutes is actually up. So Patty, if you can do me a favor
I
and
will, Max, and thank you for the opportunity.
Hey, can
No,
I
no
also
problem.
make a suggestion that maybe we put this on the agenda for the next
gonna-
meeting?
I would second that.
Just as a follow-up. It may
Absolutely.
just be, it may just be everything's, we're doing everything we could do, or,
Yeah,
but I think it would be good because this is obviously an important issue.
I
Agreed.
agree. Is there anyone else in the audience who wishes to speak?
Not seeing anyone.
Okay, then let's move on. Next, we have approval of the minutes, Board of Health meeting from July 1st, 2021. Any comments or changes or corrections on that?
No, I make a motion to approve the minutes of the July 1st meeting, 2021.
Second,
Any final comments? If not, we'll take a roll call. We'll start with Rob,
Yes.
Claudia,
Yes.
Fred,
Abstain,
Joe,
not there.
yes,
myself, yes. Next, we have the Board of Health Septic Review Subcommittee minutes of the 28th of June and July 8th.
I'd like to make a motion that we accept the minutes of the June 28th, 2021 Gloucester Board of Health Septic Review Subcommittee minutes.
Second.
Any comments or questions? Do a roll call. Rob,
Yes.
Claudia,
I'm not on the septic subcommittee.
okay, who else was there? Fred,
Joe and Fred.
Joe?
yes,
Fred, you were there?
Yes.
And I was not there, so that passes.
Mr. Chairman, I'd like to make a motion, please, that we accept the minutes of July the 28th, 2021 of the Gloucester Board of Health Septic Review Subcommittee minutes.
I will second.
I think you said the wrong date.
July 8th.
I'm
July
sorry. What was I? Sorry, July 8th.
Okay, with that correction, it was moved and seconded.
I'll second that.
Okay, and Rob, you were present?
Yes.
Fred, were you there?
Yes.
Joe?
Yes,
Okay, so that passes. Now we have committee reports, Septic Review Subcommittee, any report?
Yes, at its meeting on June 28th, 2021, the Gloucester Board of Health Septic Review Subcommittee reviewed a request to refute a previous Title V inspection report located at 24 Lawndale Circle. property owned by Edward J. Abel III and Shiloh McLeod Trust, care of Kara and Scott Richardson. The board allowed the property owner to re-inspect the system with the guidance of the Gloucester Health Department. That's the end of that report. And at its meeting on July 8th, 2021, the Gloucester Board of Health Septic Abuse Subcommittee discussed the City of Gloucester subdivision water quality regulations and reviewed the variances for the following properties at 167 Atlantic Street, proposed lot number 1. A property owned by John A. Dorima and Alexander A. Bove Jr. Trust. All variance requests were withdrawn. That ends that report.
Thank you. Moving on to new business, appointment of Max Shank.
There's the Board of Health Board Member Search Committee
Oh, I'm
updates.
sorry, I skipped right over that. Yes, the Board of Health Board Member Search Committee update.
So just by way of reminder, both Rob and Joe were nominated or volunteered to be the committee members for this. And at this point, it's what would happen is the recommendations would be presented to the board, and then those recommendations would be forwarded to, or if there's a final recommendation, be forwarded to the mayor for appointment.
How and when do we submit our suggestions for applicants to be reviewed?
That's upon your purview. So it's however soon you want to be able to do it.
There is a likely candidate in the running, Eric Kaplan, who was identified, I think, primarily by Claudia.
Have other people had a chance to, was his resume sent around or some way of, I forget, there was something sent out. Rich met with him, right?
I met with him, was very impressed.
Exactly, that's, well, I haven't had any paperwork on it. If I
Okay.
need, and if I need it, I don't know that I do.
Oh, it might be useful. Is there a resume that we can
Yeah.
distribute? We should do that.
Yeah, I don't know.
Max, do you have that or?
I don't think I do, but let me double check. Hold on one second.
Yeah, I'm not sure that there actually was. We could
Okay.
reach out to him.
I
and
don't
ask-
recall seeing one.
Yeah. I think it was more informal.
Yeah, I don't have anything from him directly. Let's see.
I mean, Rich, either you as the person who initiated the contact can reach out to him, or I can reach out to him. But just to tell you, he was on, he's a retired pediatrician. He lives in Gloucester, and I forget, he was on the Board of Health. I forget what town he was from. Do you
One of the
remember?
W's, I think.
Yeah, I don't remember. Well, I
he-
want to say Wenham, I'm sure.
No, it definitely wasn't Wenham. It was more north and west. But anyway, Woburn or maybe or something, but for many years, and it was an elected office. So he ran and was appointed for many years.
Sounds ideal.
Yeah, and he's willing to do it. And he's,
Yeah, it's breathing.
yeah. And he was president of the temple last year. That's
Wonderful.
so-
Cool.
He
So,
he also served as chair of the board whichever city it was in.
Okay.
Do we have to go through this process, or can we just make the nomination? Move on this.
You can, that's perfectly fine. It's not on the agenda, but I don't think it necessarily needs to be either. It's just a recommendation going forward to the administration.
I'd like to make a recommendation that the selection committee make a decision this evening.
I'm perfectly happy to do that. I have interacted with him by phone about a year and a half ago because he agreed to be on the recombinant DNA inspection committee, which has never been fully instituted. So this is a step up for him, and it's great that he's willing to participate in even more responsibility.
I think to be complete, we should request a resume.
Yeah,
And I think that the people on the search committee should at least speak to him again.
Okay.
right.
Yeah, a resume is needed to forward to the administration anyway with their application. So,
And he probably should compose a letter expressing his interest.
Yep.
So the search committee will be the ones to
Search.
approach him and,
Try
Yeah,
it.
I'm
I
happy
think
to do
so.
that. If one of you can forward me his contact information.
yeah, I can do that.
Okay,
I can do that right now.
And I think we should ask him to come to the next meeting.
Uh-huh.
Okay.
Anything else about the search committee?
no,
Okay, now we'll move on. I was just so anxious to deal with Max, I skipped right over. So appointment of Max, the Assistant Health Director, as the Interim Health Director. I'm not sure what we need to do besides have a motion on that, if anyone wants to grill Max.
then I'll jump in at once.
I would move to indeed appoint Max Schenk, who is currently the Assistant Health Director, to Interim Health Director,
Second,
effective immediately, if that's feasible.
second that.
I second that.
Any other comments?
Thank you, Max.
Yes,
You're
indeed.
welcome.
Yeah,
Yes, thank you, Max.
And there has been discussion with HR about this, and the HR issues have been worked out. Would you say?
Yeah.
Max, you have
Yeah,
mutual
yeah.
satisfaction?
Yep, it's all set.
Cool.
So is there anything more that we have to do so that Max can start making more money?
No, that's already been taken care of at the administration level. So all
Okay,
set on
good.
that.
I think we just need to have a vote.
Right.
So do we have a motion?
Yes,
yeah.
Okay,
and seconded.
we'll start with Joe this time.
Yes,
Fred,
Yes,
Claudia,
Yes.
Rob,
Yes.
myself, yes. Congratulations, Max.
yes, indeed.
Maybe it's
Thank you very
sympathy,
much.
I don't know.
We know you know what you're getting into.
That's true. Third time's a charm, right?
That's true. This is the third time, huh?
Yeah, it's,
his robes are getting frayed around the edges.
yeah, I had a lot more, I didn't have a lot more hair, but at least it wasn't as gray. But no, I appreciate the support of the board members as always. And I look forward to, helping to support the department and the board in the time between now and finding a new director and then helping them to onboard them when they are chosen and arrive. So thank you.
Terrific.
Thanks, Max.
Thanks, Max.
Next, we have discussion and creation of the Health Director Interview and Selection Committee.
So I'll jump in real quick. We've received, the posting for the position was closed. 10 applications were received. So what we need now are 2 board members to be part of an initial review and selection committee, and then form an interview committee. They can also be the interview committee. In conversations that I had with HR regarding best process for this, these do not have to be posted meetings, apparently, at least according to HR. And for the privacy sake of the individuals that we'll be interviewing, it's only when we get down to a final candidate that will be a public meeting.
Are we therefore limited only to 2, or can we have more?
I only put it to 2 because we had left the search committee to 2, but I don't think you necessarily are if what HR is saying is correct. So it could be 3. I mean, I get cautious about having too much of a quorum in the room, but where it's a personnel matter, I think it'll be fine.
I'd be willing to serve.
I'm.
Thank you, Fred.
I'm interested in serving.
And it does not need to be limited to necessarily the board, if the board wants to involve any partners, but that's absolutely your decision. But
You're talking about then going over the resumes to decide who to interview or the interview?
That's correct.
Two separate things, okay.
yeah,
How is it handled if the committee wants to reopen it? Can that be
they
done?
would, sorry, I would think that, 'cause I'm trying to think if that's happened before in the past. Do you think I would remember that? I think it would just be that, by recommendation of the committee, that the candidates that were, put forward, the committee felt that there weren't any that were viable candidates for the role and would ask the HR department to post again.
Yeah, I can speak to that. Remember, Max, when we had that guy who came from Illinois or somewhere, he was the final candidate?
Hmm.
And then we didn't feel comfortable with him. We had to do the entire search. We just did a new search all over again. And that's when Jack,
Yeah. Do you remember, Claudia, whether or not he was the final candidate and it came down to the final candidate? It wasn't just.
whether there was another candidate? There
Yeah,
might
or
have
any.
been two.
Yeah. Okay.
Yeah,
That's something we can ask HR about.
yeah.
Yeah. Well, I can get back to you on that.
Well, we had done a national search that time.
Yes.
Yeah.
Of
So we
the
have a committee
of the
with Fred.
resumes that
and
I've read,
Claudia.
I have selected some that I think would be good candidates to interview. How do I go about submitting those names?
I think you and Claudia discussed that and then talked to HR. Is that correct, Max?
Yes, that's fine.
Cool.
So is that what so Fred and I are, I mean, does any?
If we
Rob
can have more than two, I'm happy to participate, but
Yeah,
I
I
don't
don't-
need to.
Yeah. I don't think there are any
Limited to.
particular restrictions in regards to that. So,
I would like to nominate Claudia and Fred as subcommittee members.
and Joe?
Joe, yes, Joe also, if he's interested.
Thank you.
No, if we can have more than two, I'm
Yeah.
happy to participate.
Okay.
Anybody want to bow out and escape? No,
Escaping on the board?
no, just on the interview committee. Nobody will take a vote. I vote yes. Rob,
Yes,
Claudia,
Yes,
Fred,
Yes,
Joe,
Yes,
passes. Okay.
great. So I will then send an email to Joe and to Claudia with my recommendations for who we make appointments with. Is that how that goes?
well, yeah, I mean, I was thinking this is so different than before it was like looking at the paper one sitting down, but now everything's on email, I think maybe we can all send to each other who we think our recommendations
Yeah,
are. And then, see how that list comes out. Oh, my dog I would also think it's important to have one or two people from the health department,
Yes.
looking at the resumes. I
Yeah.
certainly value Max.
absolutely.
Yeah.
yes. That's exactly how we did it last time.
Mhm.
Yeah.
Well,
It's
then the interview, yeah.
completely up to the board and I'm happy to do that.
Good.
I would suggest one of the first things you do is figure out someone to be the chair just to coordinate all of this.
I decline a leadership position. I get too much on my plate.
Well, I've got a lot on my plate, but I'll say that I'll be the chair.
Thank
Good,
you, Claudia.
Good. Thank you,
thank you,
Claudia.
Claudia.
Since Joe's agreed to be the chair of the board.
Okay, should we move on?
Yep.
Next, we have discussion regarding the status of the Children's Dental Health Center.
So I just wanted to update the board as we've kind of talked about before. The dental center's had its many challenges and COVID notwithstanding in terms of being able to stay profitable and the support that was previously provided by the city was, and some of the costs associated with the dental center were moved from the city's general fund back over to the revolving account for the dental center, which was a big hit. There was also, with staffing changes, there were payouts for benefits and that sort of thing. So, and also the biggest problem really is the fact that appointments are made and not kept. And that has been a great challenge. So, pardon me, Karen Carroll, before COVID in October of 2019, had formed a committee that included Jim Destino, the CAO at that time, some board, I believe some board members.
I was on it.
Yeah, thank you, Claudia. And other folks and people from the dental center itself to discuss alternatives and possible ways of moving forward. And one of the outcomes from those discussions before, like I said, it dead ended because of COVID, was the possibility of doing a mobile clinic and going directly to the schools rather than having kids come to the center and count on them to show up. In discussions with the administration and also, most importantly, with the staff of the dental center, the new model that's coming forward and being supported by the administration is that mobile model. Now, the dental center facility itself would not go away in this. It would actually be used as a base of operations for a mobile unit. Now, when I say mobile unit, everybody gets in their mind the idea that there's going to be a large van and services would be supplied there. That's not actually the case. And probably the major change in all of this is going to be the fact that there won't be services by an actual dentist provided by the program. It would be hygienist services only, with recommendations and referrals made out to a dentist if it's discovered that greater care is needed. So a lot more preventative and everything on site. And then, sending them out essentially to a dentist that's willing to take Mass Health. And that's going to be the next challenge. But we have, I have meetings with dental center staff on Tuesday. We're moving, I have a budget and outline to provide to the administration. We've already begun the process of, trying to get shape around this. We have support from the school administration. I had communication with Ben Loomis, the superintendent today, who was very supportive, put me in contact with his nurse leader at the schools. And so we'll make arrangements for how this is going to actually work in the school so that it's a benefit and not a distraction for school staff and space. So I'm happy to answer any questions, but I think that that's where we're headed at this point.
Max, do you, I think I emailed you this question a while ago and didn't expect an answer. It was just by way of information. Do you have a feel for how big these mobile pieces are and whether they can be left in place at a particular school?
Yeah.
Is the school willing to do that? Or do we need to, for instance, consider keeping the existing facility as a storage place, if nothing else? Since
The existing facility, and it also reminds you, and I did look all that up for Joe, but I forgot to tell you. So, because I got sidetracked.
Not a problem.
So I did look at the equipment. It's mobile. It is fairly mobile. And talking with dental center staff, they said it's easily handled by the two people that would be part of this. So the idea would be that Diana Edgar Maloney, who is the administrator there now, as well as Vanessa Doucette, who's the hygienist, would be effectively the program. And they feel confident that they would be able to move this around. Now, the question would, in regards to leaving it on site, we can have that discussion with the nurse leader, to see if that would be an option. And but the equipment itself is not the restrictive factor in this instance. And we have an SUV with the department that, if needed, could be used to help transport. So one way or the other, we'd figure out some way of doing it. But if it winds up, so we're considering, sorry, Claudia, just one more thing.
No, no, that's okay. That's okay.
And so the idea would be that we'll pilot this also for about 4 to 6 months and see how it, and take a pulse in that time and see how it goes. And this next month is going to be a transition time, figuring out, because obviously the services at the dental center are going to come, at least in terms of dental services at the dental center, are going to come to a close. And so we'll have discussions with Dr. Poland and staff. I'm told that Dr. Poland is, looking at retiring and moving on from the work there anyway. So, so that's, I'm sorry, Claudia, you were asking.
Let me remember now what I was. About the money. It has the administration indicated that they are willing to pay for this, because when we first met with Jim Destino, he was like all gung ho and we'll find the money and, but that was a long time ago. Many moons and many CFOs ago.
Yeah, there in meetings that I had with Frank Cousins and Chris Agaranza, in relation to this, they understood that there's a large deficit. It was from last year's, I think about $77,000 that is being absorbed by the city, in addition to any of the costs incurred at this point in the transition time. But they essentially have said that they will support whatever plan is brought forward for providing services in the schools. So I'll keep you posted, but that's the last I heard.
Max, I'm concerned about the security for the children. What's the process of transporting a kid to a dentist off-site for dental treatment that's called for by the dental hygienist?
So at that point, Fred, it's an excellent question. And at that point, it would be as if we were referring to a child or the parent or guardian, like it would be any other parent or guardian. They are responsible at that point for getting the child to that location. Our responsibility is, unfortunately, I don't disagree necessarily, but is only to ensure their care at the school and their services, and then make a recommendation and a referral out that they can use to go see the dentist themselves.
It's an improvement over the way things were before we started the clinic, but one of the great advantages is that a parent or guardian did not have to take time off of work in order to be able to see to it that their child got good dental care. From exam to treatment, that there was that chaperone tie and protective service for the child during school hours.
Mm-hmm.
So we are now back to, at least the parents have the benefit of, we are making the referral for them and setting up the appointment. That's correct?
I don't know about the appointment component of it. We'll definitely make the referral. However, that's a detail we'll need to get, figured out.
But we then are responsible for revealing the dentist that will see the patient.
We're going to have to find somebody who's willing to take Mass Health patients.
That was a huge stumbling block for the parents beforehand.
It remains a stumbling block. That's the biggest challenge we're going to have right now. So, but to a large extent, this became a cost-benefit analysis. If the administration wants to support a program but cannot continue to foot the deficit, and we're not reaching as many children as we possibly could because they're not, on their side fulfilling the contract, as it were, by showing up, then the next best thing is that we basically take them out into Muhammad and meet them where they are.
I'm just acknowledging the change.
Yeah, at least
Yeah,
they're
absolutely.
getting preventive care.
Yes, and that is huge. I agree.
Yeah.
with you.
Yeah, and the issue with engaging the Family Health Center years ago to provide service
Yeah.
was kids would show up unattended amongst other people of
Yes.
uncertain backgrounds. And so part of the advantage of this, though you raised a very good point about parents having to take off work, is that parents would be there with them, or guardians. And
Yeah.
so hopefully that issue would be at least ameliorated, if not go away altogether. But perhaps we have to think about it a bit more if, in fact, requiring parents to do this is going to mean that the kids don't get the care because the parents can't take off work. Maybe there has to be some other mechanism to chaperone the kids to the family health center, assuming they would be willing to do this, of course, at all.
But being realistic, how does any parent get their kid to a dentist appointment?
They
You know,
weren't.
we all had to either take off work or,
And they,
Right, but most of these kids that we're talking about, their parents are at the lower end of the income scale. The last thing they want to do is lose a day's pay or hours pay.
Yeah.
Whereas it's less of a burden on more well-to-do people.
right, but I also wonder if they have evening hours or Saturday morning or,
Yeah,
often
possibly.
health centers
Yeah. That's
do
should be
have
part of the
an
discussion.
accessible time.
Yeah.
yes,
For people who aren't able, that's one of the benefits.
Yeah.
So,
yeah, it's just that a free dental appointment was not free before
Right.
before the dental clinic.
oh,
was
yeah, of course.
And we're assuming that they all actually have transportation too.
Yeah,
Yeah.
exactly, they don't.
Well, and that's the even greater challenge is finding somebody in Gloucester that would take Mass Health dental patients. The fear is that, the only opportunity is going to be out of town. So, but that's what we're going to have to research out. The dental center staff are looking into that.
I think the staff should also consider a program of trying to, quote, shame the local dentist into taking one kid. No, I'm serious, rather than
That's a great
trying to
idea.
find
Yes,
one
I
who
agree with
would do
you.
a lot of them.
Except
Sorry,
they
a lot
might,
of
if
people
they
do
don't take
one.
Mass Health, I don't know we'd have to find out which dentists in the community, because if you don't take Mass Health, then it would be just a pro bono all the
Yeah,
way.
it may be, but I think if we try to talk to all the dentists and just get them to take one or two kids a month or something like that.
Yes, on rotation.
That's a great idea.
That's a
Great
great,
idea.
okay.
Shall we
Okay.
move on?
Well, it's a 30-year run roughly.
It's a
Yeah,
lot of success, and thank you all for who are involved in the initial stages of creating it.
I remember the opening, Fred.
So do I.
Yeah,
Joyous. It's wonderful. Dan Ottenheimer, I believe, was public
Right.
health director. That's
Yes.
a while.
exactly.
Moving on to
Wonderful woman
old
that came
business.
up From Beverly to help us design it.
Fred, enough reminiscing.
So
The,
sorry.
next
Jumping
we have to
ahead.
revisit. I won't read the whole thing.
So the next item on the agenda exists because the staff, me, while searching through other parts of the ordinance, looking for information, came upon this particular section of the ordinance where it outlines that the mayor has the authority to sign all contracts for the city. And the discussion was, the vote was taken by the board previously that the Board of Health chair would have the authority to sign contracts. Unfortunately, the City Code of Ordinances doesn't really allow for that. It's very explicit in the fact that the mayor has that authority singularly. So, we can leave it up for discussion, but I don't think, and it's going to go too far. I'm pretty sure that this is the way it needs to be handled.
What's the contract in question?
Well, it's any grant contract, to be honest. So thanks to the successful work of, people like Amy's group and Jenna Newbegin in our office, who's the grant administrator, the department's been incredibly successful in applying for and receiving a large number of grants, as you saw in your packet. But when it comes to the point where the city has to make a fiduciary commitment to all the tenants of that grant, those have to be signed off by the mayor exclusively.
Is there anything we need to do or just?
I
move
would
on?
just, since it was voted in, we just need to vote that provision out so that you're basically rescinding your vote of June 3rd, 2021, allowing the Board of Health chair signatory authority for grants.
So move.
Second,
Any other discussion? Hearing none, we'll take a vote. Joe,
yes.
Fred,
Yes.
Rob,
Yes.
Claudia,
Yes.
and I vote yes.
So, okay, I know that's passed, but now I just have a question. Have there been issues recently about grants that we've received that haven't come to us? Or that we haven't been able, to execute? We got notice that we've been awarded it, but it's gotten stalled?
There was one grant, Amy, forgive me because I'm trying to remember the name of the grant, but there was one grant that came through that the mayor essentially went ahead and contacted the grantors directly, requiring that the requiring grant information, requiring the grant be signed exclusively by her. So Amy, do you have a moment to give an update on that?
Typically, we have a pretty standard process of getting grants through the system. Once we receive them, they go in front of the budget and finance, but there's all sorts of signatures that have to go on them. And Jenna has been amazing at creating a very concise process. The grant that Max is referring to is the early childhood prevention grant that I received very recently. Typically, the grant goes to Jenna, who takes care of everything and then sends it forward to the mayor to be signed. In this particular case, it seems as though the mayor's office went directly to the Bureau of Substance Abuse Services, changed all the information on it, and then it had to go through a different process, which ended up having us miss the deadline for the Department of Public Health to get the grant in. And it was, I mean, I guess I can let Max say more, but I know that the reason why we tried to pass that in the last meeting is because it wasn't the first one, so.
I'm trying to, forgive me, Amy, what other grant had this happened with? Oh, forgive me. No, never mind. I know exactly which grant it was. So there was a moment where there was a bit of back and forth with the administration trying to get a signature, the mayor's signature on a grant. The mayor wanted to meet with staff in order to understand what was going on with the grant further. And long and difficult story short, I eventually met with the administration. The mayor signed the grant finally and it moved forward, but it did take a little bit of an effort between the two to get it done.
It was also late.
It was late, but they, thankfully the state was pretty forgiving about it.
Yeah, but I've since forgiven us for all the lateness, but it has been late.
So I think at this point, it's a wait and see to see what happens in the future with other grants and other concerns moving forward for the department. So.
And whether we need some other, strategy, proactive strategy, working with the mayor to encourage her to, get this done more quickly so we don't lose out on the grant.
Mhm. I agree. And, and just save being late. I think that's the main thing with grant funders. You do not want to be late with things, especially if they're giving you a lot of money.
Yeah.
It doesn't look good for anybody in the city when situations like that happen. So we will, keep moving forward, hope for the best, and report back to the board if there are any other instances where this is becoming not just an anomaly, but a recurring concern.
Please do.
Thank you.
Anything else on that? COVID-19 update?
So the board members, I think, received the latest numbers. There are 14 active cases in town. There were, according to the state's website, I didn't find out until later, there were 29, I believe, total in the month of July, thereabouts. But still very low, thankfully, and no hospitalizations. The majority of cases anecdotally being reported because when we're doing our contact tracing investigations, is that the majority of people are unvaccinated. I will give credit to the mayor for asking a good question because it's part of that information that was sent out. She wondered how many people were unvaccinated in the city, and I said, well, statistically, looking at the numbers, if you assume that Gloucester has a population, at least by the census, latest census in 2019, of 30,000 plus people, then there's roughly 7,800 people who have not been vaccinated. Now, that does include children who can't be vaccinated anyway. So that's probably another, let's see, there are 16%, I think, between the ages of 5 and 18, and under 5 years old, 6%. So about 468 minimum that would have to come off that number anyway. So there's the challenge that really lies with all of us at the department, is to ensure that people are educated and people are vaccinated. And along those lines, I want to thank Cindy Donaldson and Bridget Nelligan, who stepped in as by way of department update as interim health nurses. They've done the work before.
Cindy
when
Donaldson, you don't.
Oh, forgive me.
Yeah.
Correct. No, Cindy Junker. Forgive
Yeah,
me.
okay.
Cindy Junker and Bridget Nelligan, both. Cindy was the school nurse leader for quite a while and has more energy than I don't know anybody, one person should really have. And Bridget is wonderful. And they both have just done an amazing job jumping right into the role. It was when the whole transition was happening. And as you know, it happened fast. And they basically saved me, really. And but not only did they take on the current duties as the public health nurses, they're moving forward with helping to fill this gap of vaccinations. And so we've been having conversations with the Gloucester Housing Authority, David Holden and his group, who want to hold education and outreach events at the Willowwood and Veterans communities, Veterans Way communities. We have money available to hire translators as well if necessary. So we're looking at doing 2 events at each location over a 2-week period, and then following up with a vaccination clinic at both locations. And so I'm grateful to all of them. I'm grateful for the partnership with the Gloucester Housing Authority and wanting to do this. Their feeling is that the folks will trust the Board of Health and the Health Department far more than they will, their crew. So they were grateful for our support. So, I know that the administration's working on a plan for outreach as well, but that's going forward. So they're also moving forward with scheduling flu vaccines. Remember the flu when that was a thing? And so the flu clinics will be scheduled probably starting in October. It gives them time to make arrangements to hire the volunteers needed or get the volunteers needed. And as well as, of course, the state being the state has changed the software program that they use for vaccinations. It used to be PrepMod. You may have heard that mentioned in the news. It's now called Color or Color Health, something along those lines. And so there has to be a training. There has to be, there's a train the trainer and then a training for the volunteer staff. We're sort of trying to get all that organized, the ordering of the vaccine and all the other supplies. And they're totally on top of it. They've been doing an amazing job in staying on top of any of the contact tracing that we've had to do at this point. If it does get to a level where they can't handle it, then we'll have to have a conversation with the administration at that time to hire more support like we did for the last COVID surge. And I forgot to mention, just by way of comparison, let me see if I can find that number. So we're talking about having 14 cases, active cases now. At the height of COVID, which was actually just back in January, the single day high was 36 cases, and the running total for 3 weeks running was 167. So I think because of vaccinations, because of proper masking, because of awareness, we've brought that number down significantly and provided a lot of protection to the community. With the Delta variant, obviously all bets are off. And so people are looking towards how best to protect the public with the Delta variant being out there and possibly others coming down the pike. So, but right now the community is doing, exceptionally well. Although, because the CDC measures by the county, CDC does have us in the orange zone, which is they're asking that people who are even vaccinated to be masked inside public buildings and wherever they're with the public indoors. So just to be aware.
Can I ask, please, where's DPH on distributing vaccine to physicians who have the equipment in their offices to properly refrigerate?
It's an excellent question, Fred. I don't know, but it does seem to me that the idea is, for instance, in a meeting that I was able to listen in on because the mayor had forwarded the invitation to me, the concept, I believe, is that if there should be a need for a third vaccination or a booster, that those would be provided to healthcare providers rather than necessarily just the state or local public health.
I'm just addressing the trust issue.
No, I understand. I will see if I can find out an answer to that.
Thank you.
Yeah.
I have a question. Oh,
I was just going to say, Claudia,
Sure.
to interrupt, but to follow up with Max was saying that because of the CDC decision about where Essex County is, evictions are also protected
Yeah.
until October, which is important for us
October
And-
this year or next year?
this year. It's
This
not
year?
very long. They're
Okay.
moving in.
60 days, right?
Sorry?
60 days, they extended it?
Yeah.
Yeah.
Yeah, because they would lose in court, Claudia, so they have to, this can only be a stopgap measure.
Okay. The question I had was about the contact tracing. Max, who was doing that? We don't have that contact tracing team that we had. Is that correct?
That is correct. So for a period of time when Kelly was still the public health nurse, she was using the Contact Tracing Collaborative, which is a state program, which still does exist. The problem can be, though, that there's a significant delay in the notification and tracing. So as long as we can maintain it locally with our team, we will. And if it gets to a point, God forbid, but if it gets to a point that we need to expand that, our preference would be to work with the administration to reconvene the team that we had and do it that way again.
Has our contract expired with the testing of septic?
No, it's an excellent question. I'm glad you brought that up, Fred. Well, yes and no is the actual answer. So we have a contract with BioBot, but to have testing performed until late August, I believe, but that is being funded through a program sponsored by HHS, who's doing it nationally. And it's been a little bit of an odd duck in trying to get narrowed down. My thanks to Joe for his help, and because his mind understands a lot of what's going on. He's been asking a lot of amazing questions that have helped me understand what they're doing. But essentially, the HHS testing requires 2 samples to be taken and brought forward. And thus far, although I don't have the latest numbers. There's been detection, but not, Joe, if I'm correct, not to a level that they don't give numbers of possible infected based on that. That's the
Yeah.
problem.
I don't think they can easily calculate those numbers anymore because the Delta variant is so prevalent now. No one has yet done the study as to how much people are secreting into their stool, even though they may not be ill. So it's an unknown, but it's still they're measuring detectable virus, and the blip that's appeared in the past 2 or 3 samples, I can't remember, is very small, fortunately, and hopefully it went up and came back down. Hopefully it stays down. We'll see.
And that seems to be the trend for the COVID variant, for the Delta variant. There's as you saw in Provincetown, it's a very sharp spike in cases, and then it goes down pretty quickly as well. So, but we'll see. It does have everybody nervous. It again just shows the importance of vaccination and masking when possible. So, and that's it for COVID, unless you have any other questions.
On the positive cases in Gloucester, do you know were they all unvaccinated people, or was
Not
there any
all,
case-
but the majority are unvaccinated. That's correct.
Okay. And were they clusters or individual?
No clusters. Yeah, individual.
Thank you.
For the record, if someone says to me, where can I go in Gloucester to get a vaccine shot? How should I answer?
The easiest thing for them to do is contact, if their primary care physicians aren't a resource, then they can, a lot of the pharmacies are doing it now. CVS, I believe, at both locations is offering it, as well as Walgreens, I also thought I heard. So, yeah. And also there's a website on mass.gov that if you just Google Massachusetts, where do I get the vaccine? That site will probably pop up, and you can just type in your zip code, and it'll let you know where the closest spots are.
Thank you.
Yeah, I've seen people getting it at the CVS up at Gloucester Crossing when I was
Good.
there to pick up a prescription.
Okay, cool. Thank you.
Any other comments on that? Okay, interim director's report and other departmental reports.
So by and large, you heard most of it. What I'll go through is just some of the updates. Obviously, staffing updates, the resignations of the director and public health nurse, posting of the position and the closing of the posting. And one of the things I want to bring up, though, is the hiring of the mental health navigator for Healthy Gloucester Collaborative, which is on there. And that's why I asked Amy to actually join us this evening to have a discussion about that. The review committee put forward their recommendation to HR. And right now, it's been sitting there, and HR has not made an offer to that candidate. So we're still in a holding pattern as to what's going to happen on that. But Amy, if you can do me a favor and speak to the candidate, or excuse me, the position and what its role is going to be in your program.
Sure, I'd love to. So we're really excited. I think I've shared some of this with you guys before. We have been doing a pilot program of our community health navigator. I think you guys knew a little bit about it. It was a collaboration with Children, Friends, and Family, where we contracted with them to provide 8 hours a week of someone to answer a phone and connect folks with a clinician. So
Hold on a sec, Amy. Is for anybody else, is Amy's voice a little garbled, and
Yes.
or is it just me?
That's why I'm being practically open.
I knew this was going to happen because it doesn't work unless I'm on this, but it's not working for some reason. Can you hear me? No.
Yeah, we can hear you.
Yeah, it's just difficult to understand.
Yeah.
Let me see if I knew this was going to happen. Let me see if I can't.
I'll be happy for next month's live meeting.
Oh, yeah, is that definite? I mean, as of today.
As of today, the administration expects meetings to go live again in September.
Did this help at
Yeah.
all?
That's great.
Yeah.
Perfect.
Yeah.
Oh,
Okay.
much-
I don't think you're getting it through this though.
It's much better, Amy.
Okay, so, still better?
Yep, so
Yeah.
good.
Okay, so we're really excited about this opportunity. We had an 8-hour position, an 8-hour consultation put together, like I said, with Children, Friends, and Family. We were able to pilot the program. We had a research, we paid someone to do some clinical, we consulted with MAPC to do some research around access to mental health services for young people in the region. So the most common thing that came up very glaring was navigating the mental health system. So folks were having a really hard time figuring out how to get their children or whatever access to services. So the mental health navigator is not just for youth, but we thought it would be really helpful for parents. And it was great and successful. It wasn't enough hours and there were some missing pieces. So I worked with Children, Friends, and Family to look at what was working, what wasn't. And then I set out to apply for the Shared Public Health Services Grant. So this is a collaboration between 7 communities, the 7 that I cover. And basically it was enough money to hire a full-time person for this job. Some of the things that we discussed were that the actual person doing this work probably shouldn't be a clinician. They should be somebody that is more apt at like running coalitions, making connections, finding, more like case managery. And then we still wanted to keep that clinical oversight. So we have budgeted in for 8 hours a week of a master's level clinician from Children, Friends, and Family. And then the full-time navigator will actually sit in the health department with us. We're so excited about this for so many reasons. It gives us a lot more room to do a lot more things. I'm happy to share the job description, but basically, in addition to finding people clinicians, the navigator is going to have the opportunity to do a lot of coalition work. So for example, there'll be a navigator coalition. So a coalition of just other navigators from all around the region so they can work together and share resources and best practices. There's also going to be some really basic needs stuff happening. So if someone were to call and say, I really need help, I'm so stressed out, I need a therapist, and I can't even pay my rent, the navigator would then be able to say, okay, it looks like maybe you have like a basic needs issue that we need to meet before we get the clinician. So let me help you with some rent assistance, and then we'll move on to some clinicians that are available so that people can really be able to have access to services in a place that they can receive services instead of just like, and then the other thing that's really exciting is one of the biggest issues has been obviously people who accepting the right insurance, getting Mass Health to be collected by everyone knows. I think, Claudia, we had this conversation a long time ago about how hard it is to accept Mass Health as a clinician. So one of the other pieces is they'll be helping to facilitate the Youth Mental Health Improvement Work Group. And that group is looking at different policy work, looking at how we can advocate for policy around can we make it easier to take Mass Health? And then the other thing is a network of providers. So this person will be making relationships with actual clinicians and then creating, a clinician breakfast where clinicians will come and there'll be stuff in it for them. And there might be like a panel on taking Mass Health and how we can make it easier. Or maybe it'll be, some kind of speaker, so really having building relationships with providers so that we do have a really hardy group to choose from when it comes time to actually matching people up. And then we have this 8 hours of master's level clinician a week that can be used for stopgaps, folks that can't find a clinician right away. And then additionally, we work closely with the schools. So an example, last year Ipswich lost their Leahy clinician and simultaneously had 2 suicide attempts over one weekend. And so this would be an example of a time that we would send our clinician in to be kind of like another stopgap for the schools. So there's a lot of opportunity in this position. We're very excited about it. Department of Public Health gave us a really good chunk of money. I have the budget here if anyone has any questions, and I'm also happy to answer any questions about the actual role. But it's just something we're so excited about, and we can't wait.
I think it's terrific. I mean, there's such a shortage. Our phone rings off the hook every day, you know. But did I understand you correctly that you have chosen somebody for that position, but nothing has happened with it? So I'm wondering if there's anything the board can do to move that along.
Where is it stuck?
Yeah,
It's at the HR department at the moment, and I believe they're in discussions with the administration for the selection.
so they're selecting the person? Not the group that's going to be working with them?
That, I think, is an excellent question for the board to ask the administration. I'm afraid I can't speak about it much more than that publicly, only because we are
Yeah.
talking about a posted position where nobody has been notified yet.
Yeah, got it.
So
I thought I heard that kind of at the beginning, but then we moved on. So because obviously it all sounds great, but if it's sitting on somebody's desk when there's a huge need right now that someone could be working and filling the position, we have to figure out how to move it forward.
And another challenge, just to throw it out there, we're on a little bit of a time
That
crunch.
would be my question.
Yeah, so we have, we're transitioning, like I said, this was piloted at Children, Friends and Family, and they're part of the transition plan. And so there's like a phone that's gonna move over here. There's a whole, and we have budgeted a certain amount till a certain amount of time so that there's can still be someone around to train and transition. We also, so we had a lot of swag like printed up. I have like pens with the number of the navigator on them. So we have a lot of information out there in the community, and we're really trying not to have a gap between the navigator that's there now and the new navigator, because then we're going to have people calling a number that gets nowhere. And that seems really dangerous for the sustainability of it ultimately, if that makes sense.
Yeah, absolutely.
We also have like funds, specific funds for a transition plan that are going to be over soon. We're hoping to bring someone on by the 9th at the latest, because that gives 1 week to transition from where they're at to now. So that's kind of where we sit.
What are the age of the children you'll be helping?
Oh, it's all ages. It's all ages. Sorry, I was confusing. It came up because youth is such an issue, but we want everybody to have access to this resource. So anybody that wants a clinician or feels like they need supports is welcome to call.
Yeah. So how do we move? I don't want to get away from what the problem. I mean, if it all sounds great, but if it's sitting on someone's desk and there isn't I'm wondering if the board could write a letter or make a phone call, or how do we move this forward? Because it's right now it's just something on a piece of paper, and it sounds like it's very close to actually, it could be happening next week, but something is not happening.
May I have a copy of the job description, please?
What's that, Fred?
May I have a copy of the job description so that I know exactly what I'm referring to?
Absolutely. Max, do you want to send that out, or you want me to send it to you? And I can send it directly to Fred.
Yeah, that's
I'd like
fine.
to see it too. In fact, I'm a little bit confused as to what position we're talking about, the
That's what I
full-time
wanted to
person
know.
navigator or the MS level clinician?
The full-time navigator that will sit in this office.
Yep.
The one she described.
Yeah. So Amy, why don't you,
8 hour a week person, right?
Oh, full-time.
Yeah.
No, but there's two people as far as I'm.
Well,
we
the
said.
second person, the 8-hour-a-week person, it's a little
Yeah.
confusing. The 8-hour-a-week person is just going to be appointed by Children, Friends, and Family because they're just contracting with us to have some clinical oversight and like addition. So they'll do clinical supervision with the person.
They'll
who's
do that.
navigator. What's that?
Friends and Family is doing the supervision.
Exactly, like
Wonderful.
clinical supervision, so that
Right.
there's, so that we want to have like the clinical piece still around. And then also have that stopgap clinician available for any emergency purposes. But they're already, so they've been written into the grant as a subcontractor. So they're all set, and then we're gonna pay them, and then they're gonna appoint someone to this role. And then we're gonna hire a navigator, or we were hoping to hire a navigator.
So it's the navigator's job description that I'd like to have, please.
Great.
Yeah,
I
but-
will, yeah.
I don't, but it sounds to me like this isn't something that can wait till the next board meeting to make a suggestion about or to move forward about. That's a whole month away. So I don't know if anybody else has any. The only idea I have is to write a letter from the board to personnel asking that this position be moved forward. If it's sitting on someone's desk.
Yep.
That's fine. Do you want it should come from the chair. We can talk about phrasing, but
I can work on that offline, Max.
Does anybody else? I mean, that's just my suggestion.
no, I
don't-
agree.
Fred, what do you
You can-
think?
I agree. I think it should, the timeliness of it is important to move,
Yes.
some move on.
Yes,
I agree as well.
Yes, so do I. Max and I will work on that tomorrow.
thank you. Thank you, Lee.
Because it just seems like as a clinician myself, knowing what's going on every day that goes by, that somebody could be offering services, helping people find services is a day lost.
Mhm.
And it's critical. It's just critical every day.
Yeah, and Max, were you with me the last time we met with Frank? And he
Yes.
handed out this overdose deaths and all that. So this is something relevant to that.
Right.
I agree.
If they're interested, they put their money where their mouth is, so to speak. It's not even money. The money is in hand.
Max does the
I got a
preferred,
grant. It's a lot of money. I have all the money. I just need to-
Max, does the preferred candidate know that they are preferred, and therefore we are doing our best to be able to present an offer?
I don't know for a fact. I don't know if it's official or unofficial. Not officially, all I can say is no. They don't officially know. That decision comes from, so we send forward, the committee sent forward their recommendation, a personal action form was sent forward. And then it's up to, by policy and procedure, it's up to the HR director to make an offer at that point.
I'm signing off, guys. Thank you.
Have fun, Claudia. Thank you.
Okay,
Thanks,
thank you.
Claudia.
Yeah, have a good time, Claudia.
Thank you.
Did you want me to come downstairs?
I can figure out. Oh.
So, so the recommendation of the board is to work with the board chair to create a letter to go to the personnel director regarding this. I know it's getting a little bit late, but I did want Rachel Belisle Toller from our department has been waiting patiently. I just wanted to give folks an update on the creek because I know that there have been a lot of questions and concerns flying around. Thank you, Amy, for your help and guidance and information.
I'm
And-
happy to take any questions offline. If people want to email me, I'm going to email you the job description.
Thank you, Randy.
Thank you, Amy.
Thank you.
Amy.
So Rachel, you're on. I don't have you. Let's see if I can.
There you go.
I'm going to promote her to a panelist. There we go.
Can you guys
But I don't
hear me?
think, I'm not sure her computer has video. So, but you're on, Rachel. You want to give everybody an update on what's going on with the Creek investigation?
Yeah, absolutely. So I've been coordinating with several different departments to sort of get to the bottom of our of any potential pollution sources. Throughout June and July, I've been implementing a multi-phase investigative sampling plan where I've just been kind of going upstream farther and farther to narrow down problem areas where we've had really high counts. And there have been several areas where our enterococci tests have maxed out really high levels. And we're getting really close, I think, to identifying the problem. We're thinking likely a broken sewer pipe or a leak in a sewer pipe, or maybe several pipes. We don't know for sure yet, so I'm not like, telling people that when I'm on the beach or anything sampling, but I'm working closely with engineering and DPW to TV those lines. They're working really hard to repair any holes in the lettings and to get a camera down there so we can confirm that those are the issues.
Rachel, has Bill Sanborn been able to identify sites in the area where blasting has happened for new construction?
Yes, Bill has been really helpful, just giving me a history on some of the properties in the area. One of the pipes that we are looking at as a potential issue has had recent construction. That combined with the soil quality in the marsh could be a sort of responsible for degradation in the integrity of the pipes. So he's been helpful, yeah.
Another question, has there been construction in the site where they've had porta potties?
I don't know. That would be something I would be happy to look into. I'm not even sure that porta potties would be enough to justify such high hits. I mean, the amount of enterococci that we're getting would have to be a pretty significant pollution.
There is some history of construction crews not wanting to have them properly emptied, and therefore they do it on their own.
Interesting. That would be something that's certainly worth looking into. I will.
It's off the wall, but
Yeah, no,
I
I'll look
remember
into
it.
it.
There I am, Rich, reminiscing again.
Yeah, it's pretty consistently high this summer. So, so we think there's also possible there's a couple of issues sort of combining, and working its way down to the creek. But
There's a lot of construction in that area.
yeah, we're confident that we're pretty close. We're hoping in the next few weeks to really narrow down the issue or several issues and hopefully remediate it pretty soon.
Your letter read like a detective novel. It was wonderful.
Yeah, I know. I have like a crime scene map on my desk.
I commend your 12th grade English teacher.
Yeah, exactly.
Thank you, Rachel. I appreciate your help.
Yeah, all right. Yeah, let me know if you guys have any questions. I'm always happy to talk about the creek. I get excited about it, so.
Any concerns of the board?
One thing, the after action report, it is so well written. Why is it restricted only to in-house reading? I know Rich, you suggested that a press release. Well, just I mean, can we post it on our webpage? I was surprised to find that it's only for kind of for my eyes only.
I'm surprised also.
Can we revert that?
Yeah, I don't have any answer to that. And I mean, it's a public record, so I guess people could ask for it. But I honestly don't know why. But that's a decision by the administration.
Really? Okay, I thought we created it. We're above them.
Yeah. Okay. Good luck with that. So,
Rich,
yeah, I don't know why it was put that way. I think it was meant to be, like a lot of documents are. This isn't actually the only one. They're meant to be internal for, it's part of the continuous improvement process actually for emergency preparedness and response. So,
that was a comprehensive, well-written piece.
I think anybody could ask for a copy.
Oh, sure. They had to file a request, but yes.
Well, okay.
Why don't you talk to your friends, Fred, and see if we can get it?
Fine. If you're okay with that, I will.
I'm fine with that. I believe that the less secrecy, the better.
So do I. And somebody worked hard on that. It's well written.
Yes.
That's the work of Carol McMahon and Karen Carroll,
Yeah,
by and large.
that was public money then spent creating it too. Okay. I don't know what I can do, but never mind.
Next meeting, September 2nd,
Uh,
in the old haunts, I guess.
Correct. It's already been reserved.
Bring a jacket.
Yes. Back to the meat locker. Yeah.
Motion to
Laugh.
adjourn. Someone want to make a motion to adjourn?
Yes, please.
Second.
Second. All in favor?
Aye.
Aye. Good night.
Thank you.
Good night,
again.
everyone. Thank you very much.
Max,
Good night.
talk tomorrow about that note to HR.
All righty. Thank you very much.
Bye.
Bye.
Thanks.